If you've had a cortisone injection for a knee or shoulder problem and it didn't give you much relief, is it possible that the cortisone isn't fixing your problem? I'm Dr. David, orthopedic surgeon and sports medicine specialist. I provide education, information, commentary on all sorts of sports and exercise, injuries and injury treatments and injury prevention for athletes and active people probably like yourself so that you can stay healthy and perform your best. Cortisone used to be one of the more common treatments in orthopedic surgery, and you still see it used by a number of orthopedic surgeons. I even occasionally use it for the right patient, but we are getting away from it for a number of reasons. But one of the challenges, people that come to see me as a patient, maybe as a second opinion, or really any doctor, is they may have had cortisone shots that didn't give them relief. What does that mean if you didn't get much relief from a cortisone injection? In today's Ask Dr. Geier video, I discuss that very scenario and potentially what might be going on. Shelby asks, I've had 3 cortisone shots in my shoulder due to anterior shoulder pain caused from my biceps tendon being irritated. Unfortunately, none of them worked in reducing my symptoms. I just recently had a cortisone shot for medial knee pain, and that one also didn't work. It actually made the pain worse for a couple of days. Is it possible that my body doesn't respond to cortisone? Well, I think that's a terrific question. And I don't know, without being involved in Shelby's care, it's hard to really say for sure. But one of the things that I think is important to point out, cortisone is an anti-inflammatory. In that sense, it's like Advil and Aleve. You're just injecting it into a particular joint. So in theory, it's reducing the inflammation of the lining of the shoulder or the lining of the knee, hopefully decreasing pain and decreasing swelling from that inflammation, but it's not fixing the underlying issue. Now, if it's arthritis that's causing inflammation or something like that, it may give you a fair amount of relief. But one of the things that we worry about with cortisone is if it's not getting you better, maybe there's something structural going on that's causing the pain. A meniscus tear, a ligament tear, something like that, yes, it may decrease the inflammation, but at the end of the day, it doesn't make the meniscus tear go away. It doesn't heal the ligament. It doesn't heal the tendon. If it's in the shoulder, maybe a labral tear or rotator cuff tear. So you start to at least worry that there may be something structural going on. That's overly generic and it doesn't necessarily give Shelby an answer, but that's one of the things to think about if you've had a cortisone shot and it's just not helping you that much. Now, if you've got fairly advanced arthritis and cortisone's not helping you, it could be that you're well past where cortisone necessarily can help. Again, cortisone is an anti-inflammatory. It's not rebuilding structures or making them new. It's not filling in the potholes from the cartilage damage in arthritis. It's not healing the meniscus. It's not healing the labral or rotator cuff tear. It is just trying to decrease pain and swelling. Have you had a cortisone shot? What was the injury and did it give you much relief? I would love to hear your experiences, quite honestly, and I know people all over the world would love to hear your experience as well. So below this video, share your experience. Like I said, I'd love to read it, and I know other people would as well. If you like videos like this and you want more information on sports and exercise injuries and injury treatments and injury prevention, subscribe to my video channel. On YouTube, click the subscribe button in the upper right corner of the page. I record a couple of these videos every single week and they'll get delivered directly to you. If you know somebody dealing with a bone or joint injury and is thinking about a cortisone shot or maybe has had a cortisone shot, please share this video with them. Hopefully it can help them have a better idea of what they might do. Thank you so much for watching. I really hope it was helpful and I look forward to seeing you right here next time.